permanent pacemaker in patients with conduction block after TAVR. I think this is one of the complications after TAVR, as we have many issues like stroke, like conduction block. So when I still remember when we performed the TAVR in the first Chinese trial, WINNER-A trial, we have really high instance of permanent pacemaker implantation. In that trial, maybe I think near 20% maybe after TAVR, and as we checked the data from all over the world, I think since 2013 to 2018, whatever the pacemaker implantation during the hospitalization or after maybe 30 days, we still have maybe 10% over implantation of the permanent pacemaker after TAVR. So this is a really big issue, I think, in the early periods. When we and also we checked, the time from TAVR to pacemaker implantation. So we can see the implantation mainly focused, in the first week. Yeah. And after maybe 10 days, it's really rare permanent pacemaker implantation after TAVR. And from another paper published in JACC Intervention, we can also see after 15 days, so only 2 patients, implanted with a permanent pacemaker. But now we are still confused, when should we perform a permanent pacemaker after TAVR? We actually don't have much evidence until now. And the first time, I think we can only follow, after the surgical valve implantation, and they usually watch maybe for 7 days after procedure to check if the patient need to implant maybe a permanent pacemaker or not. So from the guidelines, it's very they don't give us the exact time, when should we perform the permanent pacemaker after TAVR. From the guidelines of 2020 ACC, we can see they recommend inpatient monitoring with the telemetry for at least 2 days if the rhythm disturbance doesn't progress, and up to 7 days if the AEM is not going to be employed. Yeah. And from the ESC guidelines, we can see before we need to watch maybe for 7 days. This is the guidelines from the surgical valve implantation. And now from 2021 guidelines, they recommended the permanent pacemaker is recommended in patients with complete or high degree of VVB that persists for 24 to 48 hours after TAVR. So this is early, recommendation of permanent pacemaker. I think it will significantly, increase the permanent pacemaker risk after TAVR. The question is, when we perform the permanent pacemaker in patients after TAVR, like from REPRISE 3 trial, 245, like 35% patients received permanent pacemaker. However, the pacemaker dependence was quite low after 30 days. Yeah. Okay, we can see after 30 days, only 43% permanent pacemaker still work. And after 1 year is 50%. So maybe 0.5% of patients, they don't need to be implanted, with permanent pacemaker. So this is a question. Yeah, and also from other trials, So this is another trial, over 1,000 patients. After 30 days, the permanent pacemaker dependence, the permanent pacemaker implantation is 13%, and the rate of permanent pacemaker dependence after maybe 1, 6, and 12 months is only 1/3, percentage. I think this is quite low, dependence after, TAVR when we implant a permanent pacemaker. Yeah. So we have, now we have the problem, to be solved. Whether the conduction block is likely to recover after TAVR. So when will they recover? We don't know. How to provide a prolonged bridge pacing, for patients with conduction block post-TAVR before permanent pacemaker implantation. And the best timing to implant a permanent pacemaker after TAVR is still the question. Yeah. So and yearly we use the temporary pacemaker to be the bridge to the permanent pacemaker after TAVR. But temporary pacemakers, they have many complications like cardiogenic shock, and the hospital length of stay will significantly increase, and also many complications. So we checked for the new methods. If we can, give a bridge to the conduction block patients after TAVR, maybe for many days, and also they can walk and they can move after the procedure immediately. So we checked. We have this method, like a permanent active fixation lace for temporary pacing. So we have permanent lace, but we don't, we fixed, the permanent pacemaker to the skin surface, use a suture sleeve and connect it to the pulse generator. So this patient is infected cardiac implanted electronic devices, So this is a new method. I think we can perform this method to the patients with conduction block after TAVR. So this is temporary pacemakers. So we used after TAVR for many days. And also, I think if the patients with conduction block, when they recovered, maybe after TAVR, so if we don't put permanent pacemaker, we can save a lot of money. So this is our experience. We have the FAME study to check, if this method can work or not after TAVR, for the conduction block patients. We included 21 patients. So we have over 100 patients, 21 patients. They have high grade of AVB, or they have, the LBBB, with quite a wide QRS, is more than 120 milliseconds, and also with 1 degree AVB. So this is 6 patients with this, and 15 patients with high grade AVB. So we use temporary. We used the permanent pacemaker for temporary use for 1 month. We watched, and 70 patients, they recovered, and only 4 patients we performed permanent pacemaker. So this is our method. We puncture, and also we fix, the permanent pacemaker to the surface of the skin, and we use a permanent lace, and we let the patients to move after the procedure, maybe for the second day, and they can discharge, and we watch them maybe 1 week after, and then we check week by week until 30 days. So from this picture, you can see only 1 patient didn't recover, for the whole time, from 1 week to 4 weeks. And the other patients, they all recovered, and many patients recovered maybe 50%. they recovered in 1 week. And another 50, they recovered maybe after 1 week until 30 days. So for another 3 patients with permanent pacemaker implantation after TAVR, you can see they also recovered maybe a little bit after 1 week. But finally, they still have, the high AVB. So after 4 weeks, we still give them, as a permanent pacemaker. So from this table showed the recovery time of conduction block and the indication of permanent pacemaker. So 7 patients recovered from 24 hours from the end of the procedure to 24 hours. And 10 patients recovered from 24 hours to 1 month post TAVR procedure. So if we implant permanent pacemaker using the end of TAVR procedure for this kind of time point, we should have nearby maybe 20% permanent pacemaker raise. So if we use 24 hours, it's 12%. If we use 1 month for the time point to decide, whether we put a permanent pacemaker, is only 3.6%. Yeah. I'm going to show a case. This is 73 years old woman. She was performing TAVR, and this is EKG before TAVR, and after TAVR they have the wide PR and the QRS is good. The 60 hours after TAVR, she have atrial fibrillation and the QRS is still good. So this is 70 hours, and also 72 hours and 78 hours. The QRS increased and also the PR increased. So we this is 80 hours after TAVR. The patient have weighty and have wide QRS. Yeah. So we performed the TPPM procedure for these patients with this method. So you can see after TPPM, the patients recovered. Yeah. So this is immediately and 40 hours after TPPM. You can see we still have the PR, wide PR, but QRS decreased. Yeah. This is 1 week. So you can see the QRS are still, reduced to 176. And the pacing rate is still 45%. And for the second week, the pacing rate reduced to 90%. Yeah. And the QRS recovered. Yeah. And for the third week, you can see the QRS is normal and the pacing is 0. Yeah, and the fourth week. So we can see they still have the wide PR, but the pacing rate and the QRS is normal. So we removed, for the permanent pacemaker. So this patient actually, recovered for the third week after the TPPM implantation. Now we have a further multi-center objective performance, study to check, if this method will work, for the multi-center study. Yeah, now we include 20 centers to join this study, and half patients. We are supposed, to include maybe 100 patients. Now we include maybe 54. And also the procedure is safe until now. And actually they reduced 80% of permanent pacemaker use after TAVR procedure. So this is the end point. I hope we can finish, at the end of this year for this study. So TPPM, I think provide an important option for the prolonged bridge pacing for patients with conduction block after TAVR. And also this is reliable and safe to provide a certain buffer time to distinguish which patients should we perform, permanent pacemaker. So we can reduce the risk of permanent pacemaker risk after TAVR. And further studies, I think with large population, we are conducting right now in China from 20 centers. I think after this study, we can recommend maybe the timing of permanent pacemaker implantation, and we can give maybe the standardized management procedure after TAVR. And